everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Dr. Kara Tomlinson. She's Executive Director of System Care Delivery and Innovation at Nebraska Medicine, and Ron Carson, Executive Director of Enterprise Applications at Nebraska Medicine. Welcome.
Thank you,
Good
John.
morning. Thanks for having us, John.
Yeah, excited to have this discussion. I don't know why I love this topic. Like maybe it's because we've all sat in exam rooms in hospital rooms for a long time, and we feel like it should be improved. So I love to hear what's happening to kind of create that hospital room of the future. But before we dive into that topic, Kara, why don't you kick us off? Tell us a little bit about yourself in Nebraska Medicine.
Yeah, thanks for the opportunity, John. And I think you nailed it when you said opportunities for improvement, right? So that's what fills our bucket and why we do what we do every day. But yeah, so I help to lead transformation initiatives for Nebraska Medicine that really help to enhance the quality, the efficiency, the reliability of the care that we provide across our care continuum. And I have the honor and privilege of collaborating with many different stakeholders and helping to drive the development and implementation of different care models that help us really to achieve our longer term strategic goals.
Awesome. Ron, how about yourself?
Yeah, good morning. I'm Ron Carson as the Executive Director for Application Services. My responsibilities are making sure that we support things like our ERP, our EHR, also all of our ancillary systems. I have a training team that makes sure that we can support those users and that they know how to use those systems safely and effectively, and an integration team that makes sure they all talk to each other. I think when you were talking about the opportunities we have, I think we're at a really great nexus right now where technology is so widely available. Things that would have been considered enterprise grade are now consumer grade. And then with cloud access, we can really start thinking about how you connect all of those things regardless of where the patient's located. So the future of smart hospital rooms or hospital at homes really seems plausible now, where maybe it did not seem plausible even 5 to 10 years ago. So yeah, the opportunity is massive.
Yeah. I mean, I've often said that my favorite things are the confluence of multiple technologies coming together. And I think, the hospital room is a great example of technology, hardware, software, data, all coming together in interesting ways. But Kara, talk to us about how do you approach modernizing these older buildings, legacy infrastructure, I guess you could say, so that they work as a hospital of the future?
Yeah, I think ultimately the goal is really to create a facility that not only supports state-of-the-art healthcare delivery, but it's also flexible, sustainable, and designed for resilience over the long term, right? So we don't know what healthcare is going to look like in the future. And at Nebraska Medicine, John, we have a really unique opportunity with what we're calling the Innovation Design Unit, which is a unit that we've actually been renovating over the last 2 to 3 years in a building that is over 50 years old. So as you can imagine, there's some challenges there when you think about the infrastructure, the structural beams, the plumbing, the elevator shafts. There were definitely some things that we could not change about that unit. But it is kind of a balance of preserving and optimizing that structural integrity with also implementing forward-thinking strategies. And we've had to do that within this innovation design unit. And then I think Ron and I talk a lot to our leaders about really defining what the hospital of the future means in the context of how does that drive our organizational mission and our goals. And so when we developed and designed this unit, we prioritized enhancing patient-centered care. We had a huge focus and priority on patient safety and quality. We integrated advanced technology to help optimize the workflows of our clinicians. And then we were really thoughtful about creating flexible spaces that could adapt to the evolving needs and changes of healthcare. So I think in our case, it was really ensuring that we were meeting the needs of all three of our missions. We're an academic medical center. And so we provide care, we deliver clinical care, but we also do education and we teach the next generation of healthcare providers and we conduct research. And so really making sure that we are leveraging all three of those things.
John, and I would just maybe add into what Kara's saying too, is if another organization was thinking about doing this, don't underestimate what you can do in the space that you have existing today. You know, Kara outlined some of those geographic things, like we couldn't move an elevator shaft, we couldn't change where some of the cable runs ran to, but that didn't stop us from changing the way that doors worked in this unit. So Kara will get into this, I'm sure, at some point, but bathroom doors, do those doors swing in? Do they swing out? Do you use barn doors? Hoists, can hoists go from the bed to the bathroom, or do they just stop at the bathroom doors? And how do you design a door to do that? The sinks, we've got UV sinks that we'll be trialing. So I say that just to say, if any other organization were thinking about it, don't feel like you have to be constrained in what you can do by the space or the footprint that you currently occupy. The ability to renovate an existing space and do something really neat and innovative is really off the charts. There's very little limitation in what you'd be able to do.
Well, I mean, Ron, you're the tech guy here talking about, making sure the hoist can go to the bathroom. How do you balance kind of the design elements of the room and the floor plan versus implementing and leveraging technology? How do you find the balance of those two?
So one of the core principles we had as we were working on this unit was we said we wanted the technology to be shy. And if you think about what that means, it doesn't mean that it's not there. We just want the technology to kind of fade to the background and let the experiences between patients and clinicians be what takes the center focus. So we have a lot of things that we want to do. You talked about this confluence of technology and data and workflows all coming together. We really view this unit that same way. So we've got technologies, some of which are commonplace in other hospitals, but we are trying to think of them of how we combine them together in a way that still puts the interaction with the clinician and the patient at the forefront, or the clinician and the care team that supports that patient. So whether it's a virtual care platform that brings the patient's family members in, or whether it's that same platform that allows family members and patients to put pictures up. One of the things that I wake up thinking about is how do we make the hospital more hospitable? So a place that patients can feel more comfortable, a place where care and healing take the primary focus. And the technology, while it is cool and it is going to enhance that, it still fades to the background as part of that. So we had a team that worked over the course of 2.5 years, really thinking about what sort of technology can you bring in, but still have it be in the background. So digital picture frame, simple thing, sits on a countertop, but it can be really impactful if you can have a patient's loved ones up on that picture frame. We've talked about when clinicians come into the room, can the room orient itself around the clinician? If this is a cardiologist, can the room orient to pull up images of the patient's heart so that they can have a specific discussion about that patient's heart rather than pulling a plastic model off of a countertop? So again, technology that's really cool. It's using things like RTLS. We've talked about using virtual assistants to call this to the patient's attention, but all doing it without having to put giant microphones into the room, without having to put giant cameras into the room, and still allowing that interaction between the patient and their care team to take the primary center step.
That's awesome. Kara, what would you add? I mean, I see the RN on your title, right? The nurses, have to love this approach.
I love it. And again, Ron and I talk a lot about making sure that we're striking the right balance between the design elements of the space and then the technology that's being implemented, because it does require an approach that we have to understand the problems that we're trying to solve. And again, the problems we were trying to solve, surrounded optimizing, patient outcomes, staff workflows, creating efficiencies within our operations. And that design element and the technology should really complement each other and work together to create spaces that are functional, they're intuitive, and they're future ready. And so we really thought about those three factors of this functionality. Will the design support the care model that we are implementing and the workflows effectively? The scalability, can we scale the technology that we're implementing in the space for future advancements? And then simplicity, will the staff and the patients find the technology and design easy to use and navigate? And that kind of goes to what Ron was saying about that shy in the background technology. So I think by evaluating both of those aspects against those three things, we can make sure that nothing is overwhelming to whoever is engaging that environment, and it really supports one another.
Yeah.
And John, we've also tried to be really intentional to what Kara's saying about the problems. We've been really intentional about saying we're trying to think about problems that are 30 years out.
Mm.
And, just think about what that feels like, to think about what problems do we need to try to solve for in 30 years. So
Different mindset.
yeah, well, and if you went to UGM, then Judy Faulkner said it was 50 years. So I didn't realize we were being short-sighted and thinking about 30 years. So
I think 30 is pretty good.
yeah, so think about that though, of what sort of things do you think you're going to need to try to solve for, and whether that is mobility or accessibility. It really can start to feel a little daunting, but it also can be very rejuvenating and exciting to think about how you future-proof the technology that you put into one of these spaces.
Yeah, I love that perspective. And, I want to talk about dry erase boards, talk about 30 years from now. Should we still have dry erase boards? But, why are you excited to kind of do away with the dry erase boards and talk about what you're using to replace them? I know you have some work with eVideon that you're doing, but I'd love to hear, Kara, maybe you could start us off, talk about the dry erase board and where you're headed to kind of future-proof that.
I cannot tell you how excited I am to get away from the dry erase.
I could hear the pain in your voice of a dry erase board.
It represents a tool that, while it was very useful in the past, it can really limit the efficiency and the accuracy with how quickly healthcare is moving, right? The fast-paced healthcare environment. And so the dry erase boards are static. They rely on humans, right? So it's prone to human error. And it really lacks the ability to integrate with other systems. And so today we need real time, we need accurate and easily accessible information that we can improve communication amongst the care team, help us support our decision making, and then really enhance the patient safety. And so I think moving to these digital whiteboards that Ron can expand on will also enable us to get better data analytics. We can start to track and analyze trends in patient care, efficiencies within our operations, and then even how we're utilizing our resources. So I think the technology itself can really help drive continuous improvement and help us make more informed decisions.
Yeah, Ron, I'd love to hear your perspectives. In many ways, this feels like the facts. The dry erase board, or even paper, right? Paper was incredibly flexible. Anyone could use it. There was no training. The dry erase board's kind of similar, right? But to Kara's point, it's not real time. It's not using data. It's prone to human error. What would you add, Ron?
Well, I love this because 16 years ago, I was an IT technologist in the emergency department. And on a Friday afternoon, they were talking about how to improve transparency with patients. And so they wanted to put these clings on the patient windows so that they could write on them. And I actually went to work on a Friday afternoon, wrote this small program that we could take data out of our emergency department system and not have to use clings on the windows. But here's what I'm so excited about with this is we've spent decades, you mentioned the EHR and getting everything off of paper and digitizing it. So we've spent decades doing that. But what we have not been able to do a great job of is allow the physician or the nurse's documentation to serve as a tool itself to inform these other systems. So the nurse or the physician would document that the patient was a fall risk, and now they had to go walk over and grab a magnet and stick it on a door to indicate that the patient was a fall risk. Using Vibe's tools and having the digital door sign means that the documentation now serves as the notification also. When it goes into the system, it'll digitally show up on that door sign and indicate that the patient's a fall risk. And this is true for everything from whether they're fall risk to self-harm to diet restrictions to visitor restrictions. These were all things that were going into the EHR, and it still relied on a human component of going and updating a dry erase board or putting something onto the door. The same thing was true with the patient's goals for being able to get out of the hospital and be discharged. That all relied on something would go into the EHR, and then someone had to go write it out onto the dry erase board. So I'm very excited about this technology because, again, we are going to let physician and nurses work inform some of those notifications that are happening and that need to happen to keep the patients safe and well. Now, it presents some other kind of interesting challenges. As we were talking about this, we learned that there was some muscle memory associated with when the patient was a fall risk and they would go to get the magnet. That reminded them to do other things like grab the slip mat, and then they would be able to put the magnet on the door and the mat by the bed. So if you don't have that physical muscle memory, we have had to talk about, well, what's the way to remind people then? And we talked about this confluence of technologies already. Wouldn't it be great if your RTLS tag, as you get near the supply closet, alerts you and says, hey, your patient's a fall risk, don't forget to grab the supplies you need. So again, I think that's part of what makes this time frame in healthcare IT so exciting.
Yeah, I think that's really interesting. And there's nothing that causes more burnout and frustration than double work, right? Document at one place, document another. I think that's a powerful message of using these digital whiteboards. Talk more about the integration, Ron. It sounds like you're an Epic shop. How are you integrating, the various IT systems, including the HR, into the room? What are some examples of how you're doing that integration?
Yeah, we've got one is a fantastic integration team here that is very future forward. They do everything from API integrations, HL7, flat files, Fire. Like they're on the leading edge when you talk about quality of integration teams. I'm really, really proud of that group. Um, so we are working on trying to integrate all three of these technologies that we are focusing on, which is virtual nursing, RTLS, and
Five.
Vibe. Yeah, the patient experience. Um, so bringing those three together, I like to use this analogy, John, where I say, 10 years ago in your home, you had an iPod, you had a cell phone, it was a Motorola Razr, and you had a TomTom in your car. So you had three technologies, they worked great, but Apple came along, they integrated those all into one device in the iPhone, and now you can't imagine your life without it. When we are thinking about how we take these technologies in our innovation design unit, we think of it that way. We want to integrate these in new ways so that you can't imagine having done care without it previously. So we already talked a little bit about EHR and how that can inform the patient experience platform with eVideon and Vibe. We also want to use those real-time location services so that we can adapt the room when a clinician comes in. We'll know who the clinician is, whether that's a physician, whether it's a nurse. The future is we'll know that that's the pharmacist or a physical therapist, and we can adapt the technology in the room to match the caregiver who's in the room. We'll have video-based technology, so we'll know which of those caregivers is the patient, which one is a family member, which one is a clinician. And by combining all three of those together, we'll be able to create some really new, unique experiences that, again, keep the people at the center of that experience.
Yeah, I think when you combine those technologies, right? The Vibe, digital whiteboards, the virtual nursing, and the RTLS, you create what I call is magic, right? Like the patients are probably like, how is this possible, right? And it is that kind of magical feeling and experience, that I think is really interesting. Kara, what would you add as far as any examples of using good design and technology to kind of better address, either patient issues or even patient to nurse communication? I'd love to hear what you are excited about with this technology and the integrating of multiple technologies.
Yeah, so I think from a physical design perspective, John, we were thoughtful around how we were designing like the nurse alcoves to make sure they had really good visibility of the patients that they were taking care of. And so from our nurse alcoves, we can have one nurse being able to visually lay eyes on two patients at once. So they can see the patient physically, but they also can view the monitors that are displaying the vital signs and the heart rhythm. And this was really important from the nurses. So as we were designing the space and understanding their pain points, the one lesson learned for us, I think, was engaging the front lines early and often, especially when you're designing a brand new space, because they know the issues better than anybody. They're the ones that have created the workarounds because something in their environment is not working. or there's a piece of technology that's not working. And so that was a design based off feedback that we received from our nurses. And then we've also designed what we're calling a healthcare hub, formerly known as the nurses station, because this will not only support nurses working in that environment, but it will also support interprofessional collaboration. And so that space will serve as a central hub for patients to even be able to see their care providers working together to care for them. And so just some of those kind of intentional decision points that we made from a physical design. Technology wise, Ron mentioned a lot of those things. I think I am most excited about virtual nursing. I think it's just the tip of the iceberg when you think about our virtual care strategy, but being able to incorporate virtual nurses into our care model, I think is just going to allow patients to ask questions, review education materials through that video interface, which will then free up our bedside nurses to do more complex interactions that they have to do physically at the bedside. And I think that will help to maintain a really high level engagement from our patients. So very excited about that opportunity.
Yeah. And Ron, I'd love to hear more. You kind of mentioned, having the family's pictures available to them. What else are you doing to help patients feel more connected to their family, their loved ones, and kind of life outside of the hospital during the inpatient experience so that, they don't feel so isolated? I understand this quite well. I have many family members that have felt this, right? But what else are you doing to kind of help patients feel connected to their loved ones and their life outside the hospital?
Yeah, well, just life outside the hospital. The rooms that we are picking are sort of nature-inspired rooms. So we have built these rooms differently. They're more spacious. They don't feel the same way that a traditional hospital room might feel. Even, and it's everything down to like the walls, right? We are using a wall system where we can essentially pop panels off and then replace them with gasket heads for gases. So that's something that makes these rooms different from anything else that we have on our campus. And that's just from a physical design perspective. When it comes to being able to stay connected with their family members, we are going to have a bedside tablet that we are using through eVideon that will allow them to have some of those more personal conversations with their family members. Family members will be able to join the rounding if they're available to do it. So that's another way that we plan to be able to pull family members in, and then continuing to think about what does it look like to make that room a more hospitable place. Some of our very early design discussions were centered around like, could you put a virtual wall over by the window? And if the patient came to us from another country, then change the view they might see out their window to see something that was more like their home country.
Wow.
Or what if I just loved a vacation on the beach and I'd love to look out the hospital room and see a beach? Now, today, that sort of technology is sort of cost prohibitive. But if you think about lighting, you can do things with lighting that is not cost prohibitive, that feels much more like making this like aurora borealis lighting. If I am someone who enjoys that type of scenery, or you could make some of these lighting systems be more like stargazing. So you can start to see how there are ways within these rooms that we'd be able to make patients feel like they're in more natural spaces that are more comfortable to them. So while that's not what we have today, it's definitely something that was part of our early design discussions and trying to figure out how we can make these rooms feel more homey to the patients.
Yeah. I'm fascinated by the bedside tablet as well. You would think, oh, everyone has a cell phone. Aren't they connected? But I was just thinking about my recent experience with a family member. They couldn't pick up their cell phone, right? So having some other alternative options makes a lot of sense, where I could just dive in there and see them, or that they could just use voice to connect with me. That's really interesting. Kara, what else would you add as far as kind of making the patients and their family feel comfortable?
I love that question. I think this is my favorite questions because we know how important it is for our patients to feel connected to their family and their loved ones, and make sure that they feel like they have control. I know that I've had family in the hospital, they feel just a lack of control. So how do we give that control back to the patient? Make sure that it's a quiet, calm, healing environment to really progress that recovery for the patient, that emotional well-being. And so, Ron talked a lot about our focus on leveraging the technology, making sure that we're designing inclusive spaces, and then fostering that culture of care that prioritizes those meaningful connections. We want their families to be part of the care team. So we intentionally design space in the patient room to give them that opportunity. We've got modular furniture with charging stations, comfortable beds that aren't those springy cots anymore. So there was a lot of thought that went into that design because we don't want patients' families to feel crowded out or that they're in the way. We want to keep them in the rooms. And then part of the space within the innovation design unit has like a family lounge area. So if the families do want to step away for a moment, take a call, get on a Zoom meeting, we do have huddle spaces too that were created specifically for family or visitors.
Wow. Having slept on a bench in a hospital room and also in the bed of the patient, because that was all that was available.
Minors.
I feel your pain. So interesting. Ron, what's next? What projects are you looking at next? I love that you're looking 30 years ahead. What do you kind of see on the horizon for you next at Nebraska Medicine?
Yeah, well, two of the things that we are prioritizing pretty highly next is robotics. And it's not just like robot delivery systems, but we've talked about exoskeletons that can support physical therapy rehab for patients, as well as can serve as physical assist to staff.
Yeah.
So really excited about the idea of how we can bring some of that technology into this space and start to trial it and see how it will work for us in the future. Robotics and drone are right next to that and what that looks like. The other one that I'm very interested in, and it tag teams a little bit with what Kara was just saying about our inclusive design in this space, is virtual assistants. So not just virtual assistants that are clinician oriented, but virtual assistants that are patient oriented. You commented about not having your phone next to you, but what if you're a spinal cord injury patient and so you can't reach for a phone? Then the ability to use your voice to control that room becomes an incredibly powerful piece of technology that gives you independence during your recovery. So I'm really excited about trying to add some virtual assistants into this space and then also adding robotics and exoskeletons as well.
Love it. Kara, what would you add? What do you see next?
Okay, two really big things that I'm excited about. Number one would be ambient nurse documentation. That is going to be a game changer. Ron is laughing because if we can get this figured out, like we are totally winning this. But nurses spend so much time documenting, and it detracts them from patient care and doing what they became a nurse to do, right? Like spending time with patients, looking them in the eye, laying their hands on them. And so I think if we could leverage, AI and voice recognition technology to help capture that real-time patient interaction, it would significantly reduce the time that nurses are spending at manual data entry and allow patients to focus more on patient care. So if I think from a technology perspective, that's one of my biggest priorities. And then I think we are an academic medical center, like I mentioned before. And so as we think about building a new inpatient tower in the next 8 to 10 years, it's really how do we create spaces that are inclusive for our learners and our researchers, because we don't have a clinical space on campus that does not train the next generation of healthcare providers. And so being thoughtful about how we build in space to make sure that they feel included and not that they're, just impeding on the clinicians. And so we have so much opportunity, I think, from a design perspective to make that more comprehensive.
That's awesome. Well, you'll find no bigger fan of ambient clinical voice technology than me. And now you have that eVideon tablets in there that you could record on. So you're building towards that future. I love that. Well, Ron, Kara, I appreciate you taking time to talk with us and share about your work with making the hospital of the future and really combining technology and great design, human-centric design into what you're doing. So thank you so much for taking time to talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcast application. Thanks.